Hi, my name is Ryan Rafa. I'm a physician assistant here in Morgantown, West Virginia. I grew up in Wheeling, West Virginia. I was born and raised there, and I completed my undergraduate degree in respiratory therapy at Wheeling Jesuit University in 2016, and then I returned to school at West Liberty University and received my Master's of Science in Physician Assistant Studies in 2020. I started working in psychiatry in May of 2021. I treat both patients of addiction medicine and those that are suffering with ailments such as anxiety, depression, ADHD, OCD, bipolar disorder, and schizophrenia. Prior to working in psychiatry, I worked in the hospital setting as a hospitalist. Prior to that, I was actually a respiratory therapist. I worked as a respiratory therapist back where I was born and raised in Wheeling. The reason that I got into psychiatry is because I really saw the impact in the hospital setting that mental illness really was something that was not being treated and not the focus. And psychiatry really is a facet of medicine that kind of is part of every other specialty. Those with, say, COPD, they suffer with depression and anxiety, and treating that portion of their mental illnesses and things like that can also improve their outlook and their condition and how they do with other physical ailments. My favorite part about working in psychiatry is seeing my patients grow, progress, and their levels of anxiety going down, their mood stabilizing, their depression lifting. I'm very upfront about how I like to practice and how my style of care is. I really want it to be a shared decision between myself and my patients, to kind of us to work together as a team to come up with the best way to make you, the patient, feel better. Some transformations and benefits that I've seen my patients go through would have to be this one particular patient that I have in mind. She came to me and she had lost her job. Her relationships in her family were crumbling around her. And so after I was able to see her, we got a medication regimen that was working for her. She started TMS treatment. I got her in to see one of our therapists, and now she's doing much better. She feels as though she can start looking for work again, and she's rebuilding those relationships that kind of went by the wayside when her depression was at its worst. So I'm really excited to see how she continues to progress over time. So what I consider success in treating a patient is that they have overall improvement in things like anxiety, their mood, level of depression. And really I depend on my patients to let me know they have improved focus, improved motivation. I really look to my patients to tell me, what is lacking, where do we need to work on, those sorts of things when I follow up and we continue our treatment regimen.